and start recording. So I just want to say thank you to everybody for attending today, our TASP shortage series. My name is Elise Hendricker. I'm the chair of the Shortage and Workforce Committee on the TASP Executive Board. So the purpose of the shortage series, and this is our first inaugural one, is to try to help LSSPs learn ways to address variables that currently impact the school psychology shortage. In May of last year, our committee sent out a survey to TASP members who identified the following variables that were impacting their job satisfaction and retention. So the issues that came up were salary, caseloads, and appropriate levels of support. So we will have ongoing shortage sessions this year to provide education and awareness regarding how some districts are addressing these concerns to improve your working conditions. So we hope that these meetings provide you with tools and strategies to improve your advocacy efforts and create change in your districts. Just a couple of notes before we get started. Please note that this presentation is being recorded. This session is 1 hour of free CPD. Everybody likes free stuff. If you would like documentation of your CPD, there will be a survey to complete at the conclusion of the presentation. Evaluations must be completed by 11:59 p.m. Central Standard Time on Friday, March 10th. CPDs will only be provided to attendees that were present for the entire Zoom session and who complete the evaluation prior to the deadline. So the title of today's shortage series is How One District Manages Evaluation Caseloads. Please be aware that TASP advocates for a comprehensive model for school psychologists as outlined by NASP. The ideas that we are sharing today are examples, and TASP does not specify how districts design or implement their services. There are a variety of ways that districts can advocate for policies and practices to support the well-being of school psychologists and to improve service delivery for children and families. So we hope again that the presentations today and some of our future presentations will help you learn various models and strategies that you can continue to reflect upon and advocate for within your districts while considering your own unique needs and populations and resources. So with that, I am going to introduce our speakers today. Jeanine Egby is a wife and mother of 2 grown children. She became an LSSP and an NCSP in 2006 and has continued to serve Dripping Springs ISD since her internship year, which was 2005-2006. Jeanine became the coordinator of the Special Education Evaluation Team in 2009. She became the supervisor of special education in 2019 and the assistant director of special services in 2021. The Special Services Department in Dripping Springs oversees MTSS, 504, and special education. And then our second presenter is Lacey Kelly. Lacey is recently married and she shares 3 fur babies with her husband. She graduated from Texas State with her specialist in school psych degree in 2016 and has been working in Dripping Springs since her internship year. She became the Special Education Evaluation Team lead in 2021 and currently serves that role while managing her LSSP caseload. She oversees a team of 10 LSSPs across 7 campuses. So thank you, a big thank you to Jeanine and Lacey for being with us today and sharing some of your district practices with our audience. So within our presentation today, I will be posing some questions to Jeanine and Lacey to understand more about the model that they use to manage their evaluation caseloads in their district. If you have questions as an audience member, please place them in the Q&A tab. Your questions will be monitored by our wonderful moderators and answered if it's applicable or they're able to answer those. We have allotted some time at the end of the session to address Q&A as a larger group. So those are all my fun announcements. Now let's get to what y'all are actually here for. So let's just start by talking about Dripping Springs. So if y'all could just briefly describe your district, its demographics, number of students, diversity of students, and the number of LSSPs that y'all have to kind of set the stage.
Yeah. All right, so I totally made a typo when I sent you my description. There are 8 campuses in Dripping Springs. They just keep popping up. So 8, not 7. But basically, Dripping Springs, I guess, could be considered a moderately small, but very fast growing district west of Austin. So right now, our total population of students in the district are about 8,400, and about 13% of those, we just ran the numbers yesterday, about 1,100 are served currently in special education, with 1 million more in referral. So we have 8 campuses and 10 LSSPs. At this time, we don't have any diags on our team. So that's a little bit unique for our district, I think. Like they're open to come here. But right now, for some reason, our special education evaluation team is purely LSSPs. So that is the full size of our evaluation team. Within that group, we have 2 bilingual LSSPs. And so they have their own caseload, but they also share amongst themselves the bilingual evaluations. We do serve a lot of bilingual students, but it's not enough for just one caseload at this time. And I think they both would agree they get burnt out just doing bilingual evals. So they have kind of a mix. So our caseload, we do a bit of a split between our LSSPs. So one theme of today that we'll talk about is we are very much, since we're a team of 10, relatively small, we are a very close-knit team, and we equalize. It's like the thing that makes our team what it is, that we are very equal across our team in our caseload. Of course, we can't ever just like have a one-to-one caseload with each other, but we try to make it as fair as possible at the beginning of the school year. And so we do a little bit of a split between like a secondary LSSP and an elementary. So in Dripping Springs right now, we are campus-based. So we have offices and we pretty much have our campus. We don't work at a central location and just come to test. The secondary caseload is a bit higher. We're a little bit more art heavy. We have a lot more psychological and counseling going on, but the elementary school is just inundated with referrals. They have a lot more going on with referrals. So that's how we kind of balance the load there. And it struck me when I started making these demographics that I was like, oh, well, what it means to be an LSSP can be very different in different districts. So I just want to kind of briefly, like the main jobs of the LSSP in Dripping Springs are special education evaluation, of course. We do counseling and psychological services. We do art participation, which is different. If anyone's heard from us or used to work here or applied here, you probably heard that we, the LSSPs, were also art facilitators. But as of this year, we are moving out of that role. We do have a bit of a split right now where about 3 of our LSSPs still art facilitate and the rest are completely out of arts in the facilitation role. But by next year, we should be 100% art facilitated and we get to focus more on evaluations. And then the biggest piece, and maybe the most unquantifiable piece that LSSPs live, is that consultation and collaboration, joining in MTSS meetings. Oh, this student brought a knife to school. What do we do? So that's just kind of eats up a lot of our day. So that's pretty much what it is to be an LSSP in Dripping Springs right now.
And I think Lacey really nailed it when she said, oh, it's okay to change it, but when she mentioned the unquantifiable piece, because I think that is even more salient now, even as it continues to be unquantifiable. And what I mean by that is that we have more and more students who are at varying levels of stress or, emotional, and have anxiety or emotional concerns. And each time that we have an administrator kind of tune into a situation with a kiddo, whether they're in special education or not, they're often knocking on the door of the campus LSSP. I'm not suggesting that the counselor or the mental health professional is not getting knocks as well, but I feel like that consultation piece while it continues to be hard to quantify, we're bleeding out from 1,000 tiny cuts. And I think that we need to do a better job of getting online with the national recommendation for school psychologists, because we are doing more than just what's noted here. Would you say that's right, Lacey?
Oh, of course. Yeah, this was like the main jobs, but yeah, like
Sure.
what I do in a day, we could spend 3 hours talking about that today.
Yeah.
Absolutely. Yeah. Thank you for sharing that. And that is a big piece that we're advocating for. And y'all, I was interested because you have 8,400 students, 10 LSSPs. So you're at about 1 to 840 students for school psychs. Everybody probably knows the national recommended ratio is 1 to 500. But it's always interesting to see kind of where people are in terms of their ratio and how close they are to that. So you did a great job setting the stage for all the things that y'all are doing. So tell us a little bit about the current model that you're using in terms of how many evaluations LSSPs are doing. Tell us just a little bit about what that model looks like and how you implement that on a day-to-day basis.
Sure. It sort of begins, oh, there's a vacuum cleaner outside now. It definitely begins over the summer as we're starting to have estimates of what our caseloads are going to be. And Lacey, do you want to take over for a minute? I'm going to actually chase this very sweet lady away.
Okay, yeah, no problem. All right, so I don't know where she was going with over the summer exactly, but I'll just speak to what I know. So this current model we have, I became the team lead 2 years ago, and so I've inherited this lead. So we'll talk about where we came from and how we got here. But right now, what this looks like is that we equalize at the beginning of the school year, trying to get as close as caseloads as we possibly can. And then when we look at month to month evaluations, and we try to we know we have a couple of heavier campuses than the others, so we try to make it even based on that, because we do have some higher referral campuses just by nature than the others. You know, we have Title I schools on one side of the campus and very highly affluent on the other side, so our needs are very diverse in Dripping Springs. But so when we get together month by month, and we do have to draw this line month by month when we equalize, is what we call it. We equalize every month because we have our evaluations, reevaluations for the school year, and we know that they're coming up, but we can see right at the beginning of the school year and over the summer when reevaluations fall. And some of them might turn into just reads as FIEs, or we might be doing them. Some might already be planned from the previous school year, but those are pretty set. But then we're getting initial referrals every day, or this kid's served as SLD, but suddenly now they need a counseling eval. So there's a lot of evaluations that we can't account for at the very beginning. So we always, because we have this structure of evaluations, whether they're specially requested or they need to be moved up or their initials, they're on a very structured 45 school day timeline. So that gives us these periods where month to month, we look at evaluations that come in. Once that window closes, like on this day, this was the last day for a referral or evaluation request to fall into this month. So then I, as the lead, would reach out to my team. We use a tool, we use our Google Calendar, and we put all of our evaluations on one shared calendar, and we all have our own color, and it's a cute little thing we use, but that helps me as the lead to see who has so many evaluations. I create my own spreadsheet that aligns with every single person. I put all their evaluations on there. Basically, we see how many each person has. We do have an evaluation cap in Dripping Springs. And so right now, for those who don't art facilitate, again, we have about 3 who still do, but for those who don't, the evaluation cap would be 6 full evaluations per month. And I say 6 full with quotation marks because we know that I might have 5 FIEs that, are going to take close to 20 hours to complete, because we have this kind of broad weighted scale where we have a full evaluation will be on average take us about 20 hours of time and effort, from planning to testing, observing, interpreting, and report writing. It'll average 20 hours for a full evaluation. We have miscellaneous evaluations or half evaluations that will be closer to a 10-hour time and effort, and those will be I just need a counseling evaluation, or it's a reevaluation, but we really only want updated testing in reading. It's really not the most robust evaluation. So in 1 month, we have 6 full evaluation expectations, but it could be 5 robust FIEs and 2 little miscellaneous ones. So it gets a little in the weeds when it comes to exactly how many. So 6 evaluations can mean 8 or 9, but just depending on their weight.
And an important component of this equalization and the whole reason it got started, and I'll address that more in a later slide, is that we needed contract help. We have not been able for years now been able to, even with the, the staffing that we have, there are always these periods of time when there is just too many referrals and it's more than we can do. And so if we know that everybody's sort of assigned, or we're making sure that everybody across the district, so if I've got a really slow month, I know that I'm going to be traveling a little bit over to another campus in a different part of the district. I'm going to be connecting with that campus. I'm going to be supporting the team and that team member. I might meet the speech pathologist on that campus. The principal's like, oh, I like that LSSP. And so in the district, what that creates is a lot of visibility for the LSSPs because they are traveling around. I don't know if they all enjoy traveling around. I mean, certainly sometimes you're like, oh, and now I got to get in my car and go across the district. But making sure that we always have that amount it plugged in for everyone, that's when we know we're full. It's like there's no more room at the end. So we're going to contract out anything else that's due in this month. But you can't really get to that. You can't make that argument to HR or the business office or your director until you can quantify or show we're tapped out. There's no more blood to be given.
Thank you all for that. Yeah, I think that is why this topic probably appealed to so many people and why we have 250 people on, because I do think that what I'm hearing from people in the schools is they are tapped out, right? And so how do you implement a model where there is equity, like you mentioned, and you're communicating to those administrators and people higher up, like this is our capacity, this is what we're able to do, and here's where we might need some more help. So thank you for sharing that. And I know y'all have charts and numbers and all sorts of stuff that you're going to show us later too. So go ahead, Jeanine.
Oh, I was going to say part of the charts and numbers is that's sort of how we got there, and they're not really necessarily that elegant, but it may help you guys kind of think about how you can take information that's all around you and then get it out in front of the people who really don't understand what LSSPs do. So I think you were going to ask about the next slide. Is that right?
Yeah, I just wanted to hear, and I think for everybody in the audience, how did you get to this model? Because I think a lot of people in the audience are probably where y'all might have been, or, they're at the precursors where they are tapped out. So how did you transition to where you are now?
So Dripping Springs has a little bit of an interesting origin story in that at the very beginning, when I joined, of course it existed before me, but let me start as if my joining the district was the beginning, because that's my recollection. In the year 2005, 2006, that was also my internship year, but we were a cooperative. And so as a cooperative, we had 4 districts that we included. That was Wimberley, Johnson City, Blanco, and Dripping Springs ISD. And we were the fiscal entity, and we were the holders of the cooperative. So all of the LSSPs, SLPs, OTPT, and all of the LSSPs and SLPs were the ARD facilitators. So all of those people were in this group housed together, and we would go out and serve the different districts. What we did at that time, though, is hey, you're going to be at this elementary school, LSSP, here you go. And actually, it's kind of a small elementary school, so you're going to have half of a middle school as well. So it was about looking at a caseload, right? A number of students that could be assigned, but it was roughly because, you might have, I don't know, 45. I know that doesn't sound like a lot, but remember, this was when we were very small. So you might have like 45 kiddos at an elementary school in Blanco, for example. Shout out to Blanco. And then you might also have 60 at the middle school. And so trying to figure out what's a manageable caseload like that without crisscrossing the district created some very thoughtful from the beginning. It's like there is a caseload, but there's also a workload. So I would say that we've always been cognizant of the concept of workload. We also have a concept of elementary intensity, and Lacey spoke to that, but it's actually something we were able to quantify by just looking at 2 or 3 years in a row, and we looked at how many initial referrals per student how many were per campus. And what we found is that there was this elementary intensity. And so that helped us kind of adjust the caseloads. But in the end, you still kind of got plugged onto a campus. There's your campus. Do well, enjoy yourself, or what have you, do the right thing, help kids. And inevitably there's ebb and flow. And so there would be times when you would drown because you're sort of on the island of whatever your caseload or your responsibility is. And contracting out was, I would say, harder to get your hands around around 2005, maybe all the way up until 2010. But with companies like, should I name companies, or is it best not to?
If there's certain ones that you all contract with, I mean, we're not plugging different ones, but yeah, if there's ones that y'all use regularly.
Sure. So with the sort of advent of two local-ish companies that provide evaluation services, we really started kind of being able to tap into that. And so what happened was, though, the question always comes from the business office or your director. It's like, well, how do I know that, why are we contracting out for this campus, but why aren't we doing it over here? And so that question of, it felt willy-nilly to our directors. And I'm speaking for, we've had 5 directors in 7 years. So I know what it feels like for each one of them to say, wow, you want me to write this $2,200 check? Please tell me it's the right thing. And so that ability to kind of show when we're tapped out, to quantify what we're going to do, it really only could happen because there were outside contract test capacity, if that makes sense. Otherwise, I don't know if we would have gotten there. And I would speak to, perhaps there's some districts that are more rural or just don't have a lot of support for contract testing. And I don't know, hopefully the hiring would be the best model for making sure that y'all weren't spread too thin if contracting is not really a possibility. In transitioning, though, I was sort of speaking to the transitioning, and as it starts with, okay, everybody has a caseload, go enjoy your campus, to wait a minute, there's kind of a different workload, caseload, to, okay, now we've got to treat each other like a team. Let's make sure everybody has a manageable amount. We're going to spread it out among the group. So that's sort of how it started coalescing, if you will, really getting granular about the roles and responsibilities, making sure that whatever campus you on, you didn't have bus duty, you weren't being asked to be in the lunchroom or do arrival or dismissal. And so really holding tight to any other duties as assigned. So first thing is, we started doing is making sure you can't do that. We're contracting out evaluation, so you're not going to grab an LSSP to who's going to lose an hour of time that they could work while they're managing other tasks that don't require their expertise. So those are the little pieces of the transition. And then again, once we really had the data and we're sort of able to put it in someone's hands or face, as it may need to be, then that started moving the needle. It is something I sort of have to re-explain with each new director, and we re-explain with each new, HR or business office, because it's kind of a coalition of those two that you work with or against sometimes. But anyway, that conversation comes up, and if I didn't have the data, I don't think it would be as successful. So maybe a first hint number 1 is grab you some data.
Mm-hmm. We love data.
Yeah.
Thank you for that.
Sure.
So let's talk about, and you've alluded to data. So how do you evaluate what y'all are doing, and how do you know that it's working, essentially?
So this is, I thought this would be a good visual just to share of everything that we keep track of with a very specific number all throughout the year. Believe me, I understand there is so much we can't put a number to, and that is a conversation we are constantly having with principals and directors and whoever else. But this is what we could assign a number to. And like Jeanine said, this was based off data that's collected when it first started over the past several years. We also, since we contract with companies and they do bill us for specific hours, we were able to compare like our time and effort to theirs, at least when it came to evaluations. And this is a model we're constantly looking at. But basically, this is what I tell my team that every year they're responsible of keeping track for. So in a little bit, we'll talk about like pros and cons of this system. And one con might be that it takes time to collect this data, that sometimes it's easier just to like, bulldoze through your work because that's what's in front of you than to stop and take time to gather this data to affect change. But this is what we look at. We call it time and effort. We are constantly gathering this data, but I report it to our director 2 times per year. So at the end of each semester. So I do semester by semester and also a whole year scope. And then we have a shared spreadsheet with every year and then all the years combined so we can have side-by-side comparisons, because that's what they need to see. Because like Jeanine said, if we just say we are overworked and this is too much, they're going to be like, sure, we all are. And that's what we hear all the time, but we had to give them numbers. So basically the first 2 are the evaluations I kind of hit on, that there's many different types of evaluations that require different times. And the key takeaway is the average, because we understand there's those evaluations that have advocates involved and they want everything under the sun tested. That could take more than 20 hours. So this is an average. Some take more and less. But so we keep track of how many evaluations we do per month, week, year, that average closer to the 20 hours of time and effort. And that, again, encompasses planning all the way through report writing. And so it's all in between. And then the evaluations that are more towards the 10 hours are, since we are in a mixture right now, coming from, we were facilitating. So that meant planning, attending, consulting, and completing the paperwork. And now most of us now are just participants, where we're just going to the ones we need to plan or review or counseling evals. So there's like 2 different sections of ARDS, and districts who you're completely out of ARDS or you don't facilitate at all, you might just have one category for that. But we have a couple right now where the ARDS load that we do everything for, the ones that we're just participating in, but we don't really have to complete paperwork, but it does take time to attend this meeting. Or the meetings, sometimes there's every now and then we can't attend an ARD, but we do have to do paperwork for it. So it's kind of flip-flopped. Where we have another bullet point for our reads, like how many reads that we do that don't turn into full evaluation, so wouldn't be included in the evaluation sections, where we don't need any additional evaluation data, or they came from out of state and we just need to do a read to make them TA pretty. And those times where we're doing a read for graduation purposes. So, the different kinds of reads. Number of counseling students, that one's probably the most difficult to put a number on, because some kids get counseling like once every 3 weeks, and some kids get an hour of counseling every week in very drastic cases, but it happens. So that one, we assign a number to how many counseling students you have at one time, but that one has a bit of wiggle room. Parent meetings, we try to quantify some of these other areas where, when we call for test interpretation, or parents just need to talk to us, or we're doing a referral meeting, like parent meetings have their own little category. So do staffings and consultation. And that's really probably the hardest one to keep track of, because, staffings might show up on our calendar and that's fine. But how often, in any given day, I could have 10 different people come into my office, surprise, and they need to like talk or cry or whatever they need to do with me. And that's where it's like, I would have to remember to keep track, like tally mark or put it on my calendar. So that one is a bit difficult to keep track of, but we try our best with that one. And then the last one is contract collaboration. So this is where we are contracting out one of our FIEs, but there's still a lot of work we have to do. We have referral forms we have to fill out. We have to help provide them information. We have to get them all their referral paperwork. We have to find them a place to test. There's still a load on us when we contract out. So we didn't want to just pretend, well, that one was contracted out. You did nothing for that. So we still give a little bit of time and effort, and they're all weighted differently based on our data, which I don't have the numbers next to them. I think that's on the next screen, but that's everything we keep track of to provide this data to our district.
Yeah, that's really helpful to hear. And clarify for me and for the audience. So you, Lacey, are turning this in at the end of every semester. How often are the LSSPs giving you this data at the same time points?
Yeah, so we pretty much collect it. They should be ongoing keeping track of this, because they can't, like, come December, everyone send me your numbers, and they're like, oh, they're never going to just remember that. So it's important that, when we have new staff, or I remind them at the beginning of every year, like, this is what we need to keep track of. But then yes, once a semester is how often I'm actually collecting this hard data. Every now and then our director needs it sooner than like May. She needs it in April, because that's when we need a request for growth position. So I might need to ask it earlier, but for the most part, it's just once a semester at the end of the semester.
Yeah. Okay. Thanks for clarifying that.
And I will say, as and Lacey, you're closer to the time that you were accounting for this, but sort of because it was, me asking people for this, and I understand you're already so busy, and then I'm going to want more from you. But I think that very quickly you sort of learn some automaticity for it, and you just know to go to your calendar, put it on your electronic calendar. You know what, you had a teacher that came in just now and you thought you were going to have a 5-minute conversation, and it's an hour later, or they've used their entire 90-minute conference period in your office. And then I would just go pop it in my calendar. Things like ARDs, I don't have to really keep track of those, or I didn't have to, because they're on my calendar. So if Lacey was calling out for my numbers, or I guess she wouldn't, but in the past, if someone was calling out for my numbers, I would just be able to count my ARDs, and then I would see, oh, it's a review ARD or whatever. IEP amendments, that was kind of harder to track. I would lose track of those really easily. And then so probably some of those went unaccounted for. But while it is time consuming, it's not vastly different than if you're billing Medicaid, or if you were in private practice, you would want to be very clear and quantifiable about your hours, because you're going to be charging your clients for those. So it's not, while it sounds like a lot, it's not a lot.
Like, I don't think we all dread the time and effort. It actually kind of gets excited, like, ooh, like, let's see if I come out on top this month,
Yes.
or this semester. It's kind of exciting, but like, you do have, like, this job just in its nature requires you to have a level of organization and planning. So that's just another piece to it. But yeah, for me, it's just second nature at this point. Like, and most of your meetings are popping up on your calendar. So it's really just kind of keeping track of those surprises.
Yeah, that's a great point.
So this is probably nonsensical, but if I was trying to think, if I was in this audience right now and I wanted to come to my director, like, we can talk all day about, you need to gather data and you need to, give your director data. But I'm like, I wanted to show like exactly what data we gather, because that's going to be how they're going to apply this. But basically each line is one of my, I think this was a live document I just took out of her name from our first semester. So this is the fall semester in Dripping Springs. So basically I just get every single person's data. They have to report it to me. And then I, as the lead, will go through and I will do some math that I'm so good at. But along the top row, that's where it, like, the categories I just talked about, there they are. And they have the number of time and effort hours tied to them. Like, a full ARD, meaning you go and do the paperwork, is 2.5 hours, like maybe 45 to an hour to attend. And then the rest of the time quantified as prepping and completing paperwork, whatnot. So I'm not going to re-explain all these categories anymore, but you can see the numbers that we attach to each one of these FIEs and half evals. It gets a little hinky, but that's just the broad strokes of how we do this. And then along the duty total, that's how we can see our numbers. And so when we talk about equalizing, this tells me, like, oh my gosh, this person is struggling. They might need some more ARD support or what have you, or this really just helps us understand campus trends as well. Like, this campus is insane with staffings, and that's eating up a lot of our team's time, so that just helps us not just ask for this cap or this support with contract, but it also helps us keep our team on the same page and that we are a team. And
that when she says it gets exciting at the end, there is inevitably a sense of like sort of competition. So if you look on the right-hand column, this person, the fourth one down, they topped out at 646.5.
Yeah.
And so they have that, is that a glory, or do they have the unfortunate situation of being the one who sort of pulled the most weight? And I feel like when you talk about what are some positives and what are some negatives, I think the positive is seeing like, yes, I felt this, I lived this, but I inevitably feel like that some of the people who come in kind of at the lower end, they are often a little bit apologetic, and that is not intentional. I don't know how we can work around that. And that's part of being a team and trusting each other. It's not finger pointing. There's not, because we're all abiding by the same rules, or the whole team is. And so if they just got a lower, quarter or semester, good for you. We appreciate you. And then, hey, let's go buy a beer for the person who came out at 646.
Yeah. And just like, for the most part, this just tells us, oh, this campus might need an LSSP and a half next year, there's not, or we can offer you more art support or contract support. So yeah, it is ongoing, but sometimes we know that maybe our fall is lighter than the spring. That's why we do a comparison and a year total.
Yeah, no, it's helpful to see the numbers, and like make it concrete. So thank you for sharing that. I want to make sure we have a lot of Q&A. So I'm going to go through these next couple of slides, and then we'll try to devote some time to that. So I guess these questions kind of go together. I view them as, how you talked a little bit about this, Jeanine, but like advocating for change within the district, and what kind of data are you showing them and gaining buy-in? Because sometimes we talk about, we think that we're great as LSSPs, which we are, but sometimes maybe we don't talk the same language as administrators. And how do we kind of get that buy-in? What is your experience with that?
It's equal parts being patient and sort of reminding those that can move the levers, if you will, that how big the job is, and how it has been helpful, in the strangest use of that word. It has been helpful that there is a lot of speaking about, or a lot of recognition of the fact that there is a critical shortage, and that there's burnout, leaving the field or leaving schools to go work in more like contracting companies. And so some of it is just the gestalt of not the gestalt, sorry. It's just the time. It's the zeitgeist. This is when everybody's more sensitive to it. So that's more helpful now. So when I'm, when our current director, newest director, amazing director, all of those things, but explaining this was maybe easier than the previous director, because we're all sensitive to it. I think TASP and NASP are doing a really good job of getting that message out. So advocating within, sometimes it's the simple fact of saying, look, we can't do this. We're not going to falsify our dates. And so like kind of asking a director or whomever, is that what your intention is, that we would falsify our dates? And that's always going to be a no. And then it's like, so is it how do we feel about being out of compliance on these evals? Because that's where we're at. And they're like, no, we don't want to do that. So hopefully that didn't come across as somehow threatening, but what I mean is these are the realities. And if we refrain from speaking the realities, then it's going to sneak up on you. And there are districts around us that it snuck up on, and they had an exodus of their evaluation staff, and they are out of compliance. And so sometimes you have to say those words that you feel like, oh, is that rude to say? Is that weird to say? But you say them. And then the data, I feel like we kind of hammered that one, unless you think we're missing anything.
Yeah, no, that's helpful. I think, and like you said, having those numbers and quantifying, and obviously everybody is different and every situation is different, but I think seeing those quantifiers of like how much it really takes to complete a full FIE, right? Like that's a lot of hours. So being able to quantify that for other professionals, I think is really important. So let's close and then we'll get to Q&A, but by talking about things that are going well in your system, things that are challenging, because again, everybody is going to be able to take nuggets away from this. And we are not saying that in Frisco ISD, you have to do the exact same things as Dripping Springs, but what do y'all find is working well? And what are some things that are challenging?
So I'll start mostly because I'm sort of the one who has to go and petition, for the contract. It's like, hey, are we going to do this again? When it's time to do budget, let's set aside money, for the contracting. And I think the advantages are inherently in the ability to say, look, everybody is at their capacity. We have first considered what we can do from within. Now we need from without. And so I would say that's the advantage, is if, as long as they bought into it. I haven't had a director yet say, well, I don't care. They'll have to figure it out. So I would say that's an advantage.
Definitely. And so as a lead, I also have my own LSSP caseload. So, for us who have like boots on the ground and we're living this life, advantages would be that since we're constantly equalizing, we have this cap. One, we know exactly as much as we can what our months are going to look like. We know how many evaluations we're going to do, and we can see our ARDs. Like, it's not too much of a surprise when it comes to just the endless amount of referrals, and our caseload grows and grows and grows, but there is kind of like, we understand we have a limit. And since we equalize, probably the most important thing is that there's no one LSSP that should be drowning. And so when I talk to my cohorts in other districts or from grad school, that's kind of sometimes how it seems. Like, this person over here is having a really easy month, and this person over here has 12 evals, and it's just kind of like, good luck, and we just hope they'll have an easy month next month. So we're really keeping it very consistent and equal amongst the team. A con on the same side, though, would be, since we have a cap, that means that when we have a light month, like, oh, I only have 4 evaluations due this month, we are pulling in from the next month, or we are helping another team member. So there is no light month either with this plan. You're just in the middle, I guess, is what you could say. So we're constantly supporting each other, and the expectations are clear. So that's, I think, what makes me love this district so much. And there is quite the procedure of gathering this data, filling out these forms, seeking contract support monthly, spreadsheets galore. There is a procedure involved, but no, since I've been here and as an LSP or the lead, like, we've never been told no. So that's been a great, like, we do have to kind of like show them the data regularly, but once we show it to them, it's been fine. So that's what I would say.
As far as advice, maybe to listeners, I think that we have a responsibility to recognize when we're burning out, when there's not any more to give. And there is maybe the potential or the opportunity in that moment to, instead of saying, I don't want to work in schools, or I don't want to do this anymore, to say, I can't do more, to have that late eval. I think we feel like we'll catch fire or something if we have a late eval. And please know, TASP would not recommend, nor do I recommend, ever having a late eval. But each time we do it, each time we make it happen, when we make it happen and it was unmanageable, then we do make it seem manageable. So that would be the only thing that I would say, is make sure that before you burn yourself out, that you've made it clear that this isn't doable. And then maybe more of us, maybe we won't be leaving the field as much.
Yeah, great piece of advice. Lacey, do you have any advice before we go to the Q&A?
Nope, I think it's just, from my experience, you just have to come with numbers and clear cut information. And we love data. So I think everyone was like, yeah, we get it. So just take the time. And once that procedure is in place, it gets easier every year, and it's just second nature. But that first year probably will be difficult. But, like, we talk all the time, like, it's too much. And they just go, yeah. So you have to show them it's too much.
Yeah, absolutely. Thank you for sharing that. We have a very busy Q&A.
I don't know if that's a good thing. Oh no.
Yeah, no, it's a very good thing. So I recognize to the audience, we cannot get through everything. I will do my best to kind of hit some of the main ideas. And then we can, obviously figure out a way to maybe get some other questions answered and continue this conversation in the future. So a good question here, how important is it for your district to understand the value of LSSPs and building relationships, the campuses, and how does that look doing, I guess, more of that relationship building on the front end? Can you talk a little bit about, because I think what y'all have alluded to is like you all are very valued. So can you, I guess, talk about what that looks like and how you've gotten to that point?
I think part of it did come from the fact that we have been ARD facilitators for a while. And right as everybody cringes, I just want to take it a step farther, is that as an ARD facilitator, instead of an LSSP at the ARD, we are very connected to the entire conversation, including the goal development, the review of progress, that consideration of LRE I guess in a different way if you're also working towards consensus in an ARD. And so I think the first ways that teachers, both gen ed and special ed, and your fellow special services teams, SLPs, OTs, PTs, et cetera, and importantly, administrators, when you are a voice in the ARD that is sort of helping get to consensus or bringing everyone together and feeling really good about a well-written IEP, I think that allowed us to be seen as more than just the evaluator or the person providing counseling. So even as we're pulling out of ARDs, all of the current teachers, administrators, et cetera, they still think of the LSSPs in that way. So the consultation is about teaching strategies and of course, things related directly to being an LSSP. But I guess one thing that I feel like sometimes we forget is that while we may not know, we may have not spent time learning to teach, what we know in spades is how kids learn. And so don't ever underestimate the power of knowing exactly how kids learn, and then being on an equal footing to, talk to teachers when they speak of from their role as teaching. And so I don't know. I think that while it's very positive to be appreciated in a district, I'm going to go back to that 1,000 tiny cuts though, because in any given day, I'll just use Lacey's office. She'll have at least 10 people come in, right? Is that about a daily average? At least 10 people, 3 administrators, 2 counselors, and 4 teachers or something like that, right?
Yeah, but I'm popular, so.
Okay, that's it. It's just because she's sweet.
Yes.
Yeah, thank you for that. There are some clarifying questions in the chat, so I'm going to try to group some of them together. Some people are asking, since you all do not have diags, when you're quantifying a full eval, does that include ID evaluations, SLD? Is that considered a full eval? And how did the number of 20 hours get defined as a full evaluation?
Sure.
Right. So yes, we do all the evaluations. I forgot to mention the one thing that we don't do is FBAs for the most part. So that's one thing they've been able to take off our plate because we do have behavior specialists. But yes, we are doing dyslexia, SLD, ID, everything else. So when we say 20 hours, we understand like we might have these cases where they're like, they want an ED-AU differential and they have ADHD and they probably have dyslexia. And we often get those evaluations where we're like, oh, they're ID and dyslexic, right? So yes, like this is kind of a very black and blunt way to weight evaluations. I think in the future, we are going to move towards more of a weighted evaluation where we're looking at, I don't even know what that would look like right now, but we do more than that stark 20 versus 10. we will kind of differentiate it more, but right now that's where we're at. And the 20 hours came about, so it moves around a little bit. Like last year, I think our time and effort average was 22, but then, so we do take continuous data. Previously we had to do it for our ESHARS billing, or not ESHARS, Medicaid billing. So like the program we used, it made us like quantify, like I spent this much time scoring and interpreting and this much time, like testing and observing. So like we had to already document that for our Medicaid. So that kind of was just already happening. And then since we work with contract companies, they also are doing very similar evals to us, and they are billing us with specific hours. So that's how we kind of are moving around the needle a little bit and how we arrived at 20 for this year. But it's been 12 before for a full evaluation. It moved up to 22 at one point. Now we're down to 20. So we are continuously gathering this data and trying to keep track of about how much this would take. But we understand like an initial look at everything versus an initial SLD only is different, but that's why it's kind of a blunt average at this point.
We have a very, like our policy of dyslexia evaluations is completely compliant, as probably everybody's is, with the Texas Dyslexia Handbook. And so, honestly, I feel like there's not as much difference between maybe doing a psychological evaluation when you just kind of poke around a little bit in cognitive and achievement, and then you're really focusing on psychological. I don't know that it takes any less time to do a comprehensive evaluation, really drilling down into not only is dyslexia present, but what are the impacts and what kind of dyslexia either. So I think that the time when we used to be able to say, well, this eval is this and a diag can do this. I think it's very different now, given that we know more and we have better tools and more is expected of us.
Oh, thank you for that. Someone asked, when you are trying to equalize the number of evaluations, how are cases assigned to each LSSP?
Oh yeah, oh, that's my entire life as the lead. So I kind of was also looking through the questions. And so just to make it clear, we only cap evaluations. We could have 1 million or 5 ARDs every month. We could have 10 versus 2 counseling kids a month. So it's really, that varies a lot. So the one constant we have is the evaluation. But so how we equalize is that when the referral period ends at the month, we understand like March 31st versus April 1st really isn't that different, but that's how we kind of clearly draw a line because it has to be drawn somewhere. Right. And so once we leave the referral period for March, I say, everyone, make sure all your evaluations are on the calendar. I look at it, make my little spreadsheet, and then I can, through my spreadsheet, I do like a side-by-side, like I had 5, but Tammy had 12, so I get to see just like kind of a chart of the different evaluations just from my side. Everyone can see it on the calendar, but it's kind of a mess when you're looking at 10 LSSPs evaluations a month at a time. So I kind of piece it out person by person. And then that's when I send out an email to the team saying, okay, Tammy's the winner. She has 12. This person can take 2, this person can take 1, this person needs to give up 5. And then our team works really well together. So they kind of know who to grab. And we have a couple of like shared campuses. So we just know this person will likely take from this person because we kind of are clustered west and east. Mm-hmm. So it's kind of a free for all. The people who need to give up evaluations, if they've already, like they had 10 that month, but they've met their 6, they go through and they change their LSSPs, their evaluations up for grabs to like a gray color on the calendar, for instance. And so if I was picking up from them, I know that one's up for grabs, and I might go look in, eSped and see what the nature of the evaluation is, and also like kind of manipulating my due dates to make sure I have a pretty little spread, just stuff we take into consideration and we grab. And then once everyone has grabbed, everyone's at their 6, I see, oh, we have 12 left over this month. And that's when I'm filling out contract needs forms and coming to Jeanine and asking for that contract support. So it's a little bit of like levels of the process. It's an ongoing process. It pretty much never ends.
Yeah, that's understandable. I'm going to try to get to a couple more questions before we close. There are a couple questions in the chat related to balance of time outside of work. So can you speak to how much your LSSPs are working outside of working hours with this system that you have implemented?
Yeah, so how much is, it's up and down. With this model we have in place, it's just a way to know our expectations and to put a limit. But even then, we are working outside of our hours. This isn't a perfect system. And, you know, because my day is spent so much time consulting and calling and emailing and counseling and testing, whatever, that a lot of my report writing is done outside of the school hours. You know, some people like to get here really early in the morning and they're like really front loading work in the morning. I'm a night owl, so I'd rather take it home. But no, we are working outside of the school hours. Can I say every day? No, but it does happen. And some of us are just more efficient than others. So it's still happening with this cap because of the death from 1,000 Tiny Cuts. That's what you should call this series. So, because there's just like, I plan out my day, I come to work and the phone doesn't stop ringing and I have 3 people lined up at my door, no joke, you know, and I was like, get out, I have to go to this art and this, I have to test this kid. So, I mean, just, we know because we live it, we just can't always plan for our days. But then there's some days like everyone seems to leave us alone. So it's kind of hit or miss with the business of the week, but no, not a perfect system by any means.
Yeah, no, thank you for being honest about that. And then the last question that I'm going to ask, and I recognize there's still a lot of unanswered questions, so we will do our best to figure out how to follow up on this because it obviously has a lot of interest. Somebody asked, rather than justifying contract work with the evaluation cap, why not just use that same data to support additional positions for your team?
Oh my goodness, I'll take this one. Yes. Oh my goodness, that is what we try to do every year. The strange thing is that I don't think TASB knows what we do. Stetson does studies. I don't think Stetson knows what we do. And so if we'll have these workplace studies, they come up with numbers that are never, we are always over whatever evaluative body says that we need, because they're ignoring the national expectation for LSSPs. So we are able to show them, like, we spent $109,000 in contract testing last year. We spent $106 the year before. This could be 1.5. I mean, you know, with benefits and everything, it's hard to calculate for exactly what that looks like. But we try every year to say we want the bodies. We don't want the money. But that is something that is almost impossible to get past HR. They will, and the business office, they both know that we just spent $109,000. They know that we're projecting spending that much or more if we don't have more people. But there is also, you know, school districts have ratings, and to maintain a 5-star rating, school districts need to demonstrate that they're judicious custodians of taxpayer funds. And one of the I don't know, metrics for that would be how you staff. There is also knowledge that generally there is grant money for evaluations, or that can be directed towards evaluations. I would argue that grant money could also be used for persons, because I've read the law that goes along with the grant money. But that would be our first choice, and it is disappointing every time that data and those checks being written don't move that needle much.
Mm-hmm. Yeah, no, thank you for being honest for that, because I think that is a question that a lot of people have. You know, if we're paying for all these contract people, let's just keep the money here. But, you know, it's a lot of advocacy for sure. Yeah. Well, I recognize, oh, we already did that. I recognize that we are running out of time. It's 4:28. So I want to be judicious with everybody's time. I want to thank everybody for attending. I hope you found the information valuable and that you've learned, just a little nugget of something that you can take back and share with your teams and your districts. Remember, if you want documentation of your CPD for today, please scan the QR code on the screen to complete the evaluation. Reminder that has to be done by 11:59 p.m. Central Standard Time on Friday, March 10th. You only get CPD if you are present for the entire Zoom session and you complete the evaluation. I want to give a little plug for our next shortage series, which will be here really quickly. It will be on Monday, April 3rd from 4 to 5 p.m. Our talk is going to feature Shannon Henderson of Frisco ISD, and she is going to talk about strategies for building a healthy work culture for school psychologists. Last plug, if you are not a member of TASP, please consider joining so that we can continue to provide you with ongoing resources. If you would like to be involved in TASP, part of our shortage committee, please reach out to me. I'm always happy to connect with you. I'll put it back on this screen in case anybody missed the QR code. A very, very big thank you to Lacey and Jeanine for sharing their time and their expertise with us. We know that it's a busy time in the schools. I say that, but I think every week is a busy week, but we're headed towards spring break, so it's getting even busier. But we greatly appreciate your insights and your time and sharing a little bit about what you would how you manage everything in your district. I also want to give a shout out to my moderators who helped with some of the Q&A in the chat as well. So thank you, everybody. If you have questions, concerns, comments, if you liked this or have other topics that you would like for us to consider in the future, please just reach out to me. I'm happy to connect with you, and we hope that we see you at our next event in April. Thank you so much.